everybody, this is Dr. Sadler with Creating Future Nurses, and today we're going to discuss prioritization in nursing. So we're going to talk about how to prioritize your NCLEX questions when you have NCLEX questions. So if the question says, what's the priority? What do you do first? What do you do next? What's most important? Those type questions. So to determining, what your priority might be. And so we have a few categories that we're going to look at here when we're talking about how to prioritize. Our first being ABCs, airway, breathing, circulation. So your airway is your airway blocked? Is there something blocking your airway that's preventing you from getting breathing in appropriately? The second one being breathing. What's your pulse ox like, right? And then the C, circulation. Are you bleeding out or something like that? So ABCs, that's a priority. People always get that mixed up, and they think about, especially if you have a post-op patient that's in pain, right? And they always want to say pain is the priority. However, I always tell my students, it's not really going to matter much how much pain they're in if they're not breathing, because they won't have to worry about being in pain after a while of not being able to breathe. So airway, breathing, circulation, that's a priority. Our next category when we look at our prioritization questions is Maslow's hierarchy of needs. So remember Maslow's hierarchy of needs, you learned that in fundamentals, right? So when you look at that Maslow's hierarchy of needs, that first layer, that bottom layer, that's your physiologic needs. So that includes things like eating, sleeping, elimination, even sexual needs can be considered in that category. Then your next layer is safety and security. So do you feel safe at home? Is someone abusing you? The nurse is talking about care going home, but you're afraid to even go home. So safety and security. Then our next layer is love and belonging. Do you feel loved? Are you close to your family? Do you have a social network? Do you have friends? Things like that. Then that next layer is your self-esteem. So do you feel respected? What's your self-esteem like? And then that top layer is self-actualization. Not a lot of people reach that level. When we talk about self-actualization, you've actually reached all your goals, you're comfortable in yourself, you're not intimidated by others and their ideas because you're so comfortable with your own self. So not a lot of people reach that self-actualization layer. So the idea behind Maslow's is if one level is not met, then you're not motivated to go to the next level. So a lot of times our patients are stuck in that physiologic need because that's why we're seeing them, because something's wrong. And so they can't focus on those other things because their physiologic needs aren't met. So if one layer is not met, they're not motivated to go to the next layer. Next being nursing process. You remember nursing process from fundamentals as well, right? Add pi. So your first one being assessment, diagnosis, planning, implementation, and evaluation, right? So assessment is always the first thing we want to look at. So when we're talking about our prioritization questions, remember this: assess unless in distress. A lot of times people always want to choose the answer that says, call the physician. Well, you're going to call the physician and tell the physician what? The physician's going to say, what is your assessment? You can't say, hold on, let me go and assess the patient, right? So assess unless in distress. Now, obviously, if the person's in distress, their airway's blocked, then we need to choose the intervention, right? We need to do the Heimlich maneuver or something like that. If you check a blood sugar and their blood sugar is 40, we need to choose the answer that's going to allow us to do an intervention because they're in distress. Now, obviously, you're going to have to know your nursing skills in order to understand if your patient's in distress or not. Now, if your patient is not in distress, then you want to choose the option that's going to allow you to assess the situation further. Okay? Infection control. Infection control is always considered a priority. Example, you have patients with open wounds, pressure ulcers, right? They're obviously at risk for infection because that first layer of skin has been broken. So anytime that first layer of skin is broken, your patient's at risk for infection. So you want to implement measures that will prevent infection from entering your patient's body. So infection control is a priority. Safety. Safety is also a priority. So let's say we have schizophrenic patient that might be in a manic state, and there's other residents around or other clients around. Our priority is safety for the individuals that's around and safety for that patient as well. We don't want harm to come to that patient. So we want to make sure the patients are safe, the other individuals around them are safe, and that patient is safe as well. Also, when we talk about safety, say you got a depressed person, right? Depending on how severe that depression is, they may be contemplating suicide. And so their safety is a priority. A lot of times people want to say, doing things to help them out of their depression, talking to them. Yeah, those are, things we would do. However, our priority is safety first. If they harm themselves or commit suicide, then we won't have to worry about talking to them. So safety is a priority. Which kind of leads me to my next one, physical over mental. So it's really confusing for some students because, yes, we teach you to provide holistic care to your patients, meaning you need to look at their spiritual needs, you need to look at their mental needs. Yes, we are interested in those things because we need to provide a holistic approach to caring for our patients. However, when we're talking prioritization, physical will always take priority over the mental needs. We are concerned about those mental needs. We are concerned that that patient has the knowledge that they have. However, priority is always physical. So if there's a physical issue going on with that patient, they've been injured or something, then that's always going to take priority over the mental needs. Acute versus chronic. When we talk about acute versus chronic, your acute needs will typically take priority over your chronic situations. So say you had a person with chronic obstructive pulmonary disease that's managed with their medications. Now that is going to be a chronic condition, right? Because they're maintained with their medications. However, if they had a respiratory issue that exacerbated or something, maybe they developed pneumonia or something, went on, then it becomes an acute condition. So your acute conditions are always going to take priority over your chronic conditions. And then least invasive first. Remember that, because let's say we had a dementia patient that maybe had an outburst or something, right? The first thing we're going to do is not put on restraints. Now, restraints can be physical or they can also be chemical. So we don't want to say, give them the meds to calm them down. We don't want to say, put the wrist restraints on. That's not the first thing we want to do. We want to be able to document everything we did prior to that to try to calm them down and de-escalate the situation. So always try your least invasive first. You should be able to document your least invasive measures that you perform before doing any invasive measures. And then I have a couple of other quick notes over here when you're answering questions. Don't add to the question. The question is the question. And a lot of people get mixed up because they say, well, what if this happened? Or what if that happened? There could be a million what ifs. The question is the question. Don't add to it. Don't say, oh, the person could be this or the person could be. No, the question, whatever the facts you have there are the facts you have there. So don't add to the question, okay? And then another note I have here, don't think about what you see or do at work. A lot of people get confused with that as well because they might say, oh, I saw the nurse at clinical do this, or the nurse at work do this. Just because you saw them do it doesn't mean that they did it the correct way. Your school and your instructors are going to be teaching you the correct way and the proper way of doing things. So you need to focus on that. When we're talking NCLEX world, NCLEX assumes you have all the staff you need, you have all the equipment you need, and so you should be doing it uh, the correct way. Perfect world scenarios, right? We had everything we need to do this appropriately. So don't think about, and so a lot of times they get confused. Well, that's not how the nurse, for example, if I'm teaching how to administer medications through a PEG and I say administer them one at a time and flush in between each med, they say, well, the nurse at work puts them all in at one time. Again, just because you see that being done doesn't mean it's the correct way. So don't think about that. Think about what your instructors are telling you and teaching you, because they're teaching you the proper way of doing things. So don't get confused with that. Okay? So let's look at a couple of questions here and how we might answer prioritization questions. Okay, so you have a nurse is caring for a postoperative client who suddenly becomes restless. The nurse should take which most appropriate action? Are you going to 1, notify the surgeon, 2, medicate the client for pain, 3, check the client's vital signs, or 4, talk to the client in a calm voice? So let's break down this question here. So you have a restless post-op patient. That's really non-specific. Yes, they are post-op, but being restless could mean a lot of different things. Remember, we said you can't add to the question. The question is the question, and the information we have to go on is all the information we have to go on. So you can't assume the patient being restless means they're in pain or something's going on. We need to further assess that situation to see what might be going on. So let's look at our options. Notify the surgeon. A lot of times that's the first thing people want to do. But you're going to notify the surgeon of what? There's really nothing to notify the surgeon of until you assess the situation. And like I said, the surgeon's going to say, well, what was your assessment? You can't say, hold on, let me go and assess the patient. Medicate the client for pain. So there's nothing really there that indicates that the patient is in pain. Remember, I said don't add to the question. Just because they're restless doesn't mean that they're in pain. They could be, but we need to further assess the situation to see what's going on. Check the client's vital signs. So that is one that would allow us to further assess the situation. So let's hold on to that and look at our last option. Talk to the client in a calm voice. Okay, well, yeah, we definitely want to talk to our clients in a calm voice, but is that going to help us to find out more about what's going on with our patient? Not necessarily. So we need to find out what's going on with our patient. So in our list of priority things that we could do, where would this fall? This one would fall under nursing process, assess unless in distress. So there's nothing here that indicates that this patient may be in distress. So we need to choose the option that's going to allow us to further assess the situation. And that answer is going to be check the client's vital signs. So we want to check the client's vital signs and then see what's going on to further assess this patient and see what other steps we may need to take. Okay, let's look at this question. A client with a diagnosis of cancer is receiving morphine sulfate for pain. What is the priority nursing action? So let's look at our options. Monitor stools, monitor urine output, encourage fluid intake, encourage the client to cough and deep breathe. Okay, so a lot of times people are going to look at this and say, oh, morphine sulfate, that's going to cause constipation. That is correct. It's going to cause constipation. And so then they might look at that and think, oh, so we either need to monitor stools or maybe encourage fluids to prevent constipation from occurring. However, the question asks, what is our priority nursing action? So when we go back through those lists of priority options that I gave you, where would this fall? We also know morphine sulfate can decrease the patient's respirations. So ABCs, airway, breathing, circulation. That's where our priority is going to lie here. Which one of these is going to help us promote breathing? And that's going to be option 4. Encourage the client to cough and deep breathe. So that's where our priority is going to be at this time. Our breathing is going to take priority over our stools or urine or anything at that time. Remember, we said if you're not breathing, nothing else matters. You won't have to worry about your stools after a while if you stop breathing. So if you enjoyed this video and you'd like to see more videos like this, then please consider subscribing to my YouTube channel, Creating Future Nurses. Thank you for watching and have a great day.